Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. I have been doing these now for 4 years, and we're up to number 336, which is pretty incredible, actually. So today our guest is Martha Faraday. This is her 5th webinar that she's come back and talked to us. And I'm going to turn it over to her and let her do an intro and then dive right into the topic. Hi, Martha. Thanks for joining me.
Hey, Wendy. It is my pleasure. And the greatest compliment is to be invited back. So thank you. Thank you so much for that. So I'm a unusual background for a person who comes into equine health. So my background's actually in human evidence-based medicine. I have a PhD. So I'm a scientist. You ask me what I am, I always will first tell you I'm a scientist. First, last, and in the middle, because it's that training that supports me in figuring out what's wrong with your horse or anyone else's horse. And I work with horses with all kinds of things wrong. But what my practice has become is probably 2/3 horses with things wrong that either no one knows what to do about, or they actually don't know what the thing wrong is. So the tougher cases. So lameness is a good topic for this because lameness can be one of the most frustrating things that owners have to deal with. And it's also deeply frustrating for your horse. And I think that sometimes gets lost in the equation. So I need to share my screen, Wendy. How do I do that?
You just go up to the top where it says turn screen share on. It's to the right of you got video, mic, background effects, and then turn screen share on.
Okay. Okay, got it. All right.
Yep.
So let me get to the correct one. It's not. Let's see. There we go. All right. So you should see the title slide, and let me switch these, I suspect. There we go. Okay. So do you see?
Yeah, you just need to start the slideshow.
Okay. Okay, perfect. All right. So what this is about is, a way of thinking about equine lameness. And this is sort of crafted for you. It's for the horse owner so that you have your own framework. When you're
Martha?
Yeah.
Just hit start slideshow because right now we're seeing design. And so it'll be bigger if you just start the show, like where it says at the top slideshow on your PowerPoint.
Start.
Yeah. So right now we're seeing it in the design where you would be designing it instead of actually playing the slideshow.
Okay.
So on the top menu there where it says slideshow next to animations, if you click on that, it'll tell you to start slideshow. I can't do it for you.
Yeah, I actually don't have that. So hang on one sec.
You're really close to it.
I know.
There you go. So start from the beginning.
From the beginning. Okay.
There you go.
All right. So
that should make it bigger, which it hasn't yet. Did you click on that?
I did click on that.
Yeah, because we're still seeing it. It didn't go to presenting mode, did it? Should have gone to presenter mode rather than showing up in design mode. And that's start from.
Yeah, on my screen actually it's in the slideshow, so that's what's
okay. Maybe just go out of screen share and do it again, and then go back into screen share because maybe it's just the screen share that didn't work. Okay. So go out of Kartra's screen share. So this is why I like you to sign in early because we can test this out. So on the top menu where it says turn screen share on, turn it off.
All right, hang on, I got to find it again. Where is Katra? There it is. Oh, I see. Okay. Stop sharing. All right, stop sharing.
Okay. Then go and turn your slideshow on and then share screen because we were in build mode rather than present mode.
Yeah. Sorry, tech. No, that's not right. Hang on. Ugh.
So is the PowerPoint on your desktop?
I'm looking at it. It's
Okay.
in the slideshow, but it's not apparently not showing on your end because.
Well, you just have to start it so it plays from the beginning like we just did, and then go back to screen share.
All right. Okay, I have one. I can't find the Katra. That's the problem. Where is that? What would that be under?
It would be a tab on your browser.
Okay, I see it. All right. Let's try again. Okay.
Otherwise, the slides show up really small because we get all of the editing stuff around it. Ah, there you go. You got it. Good job.
Okay. All right. Nobody move. Okay. All right. Sorry about that. I hate tech and I don't have the mind for it. Okay. So this is, as I was saying, this is about sort of a way for you to think about your horse's lameness and feel like you have a thinking process to troubleshoot lameness when it's not something obvious. Because that is the most frustrating kind of circumstances. So first, let's just define what we're talking about. So what is lameness? This is from the Merck manual, and it includes standing or moving abnormally, and sort of in two categories. One category, the first one, is the horse can't stand or move normally. And this is some level of weakness. This is typically, there's a neurological component or a range of motion component, but this is not a painful abnormality. It's not a painful lameness. So I'm not going to talk about that because that is the less common version. The second kind, which is by far the most common, is the horse is unwilling to stand or move normally because he or she hurts. And that's what most of us grapple with most of the time. That is the most common cause of losing the use of your horse. Your horse can no longer work. They can't do their job. And when you think about lameness, the important thing to remember is lameness itself is not a disease state. It's a sign that something's wrong. So in this form of lameness, the lameness is from pain. And the lameness tells us there is something wrong. And the question is always going to be, okay, well, what is wrong? What is causing this problem? You can think of this in two categories. So one is the short-term one, and most of us have had some experience with this. That usually it's self-limited. It resolves with support. So your horse has a stone bruise or an abscess. Your farrier felt he had too much foot and trimmed him back really deeply, and now your horse is sore. You did a longer ride than you usually do on footing that is more rocky than expected. Those kinds of things that you're pretty sure you know what the cause is. It's recent, so it just happened, usually within the last few days. And those things typically just resolve on their own with support. I have a note here. The reason I put abscesses equals rare is this just a sidebar. Horses should not regularly abscess. If your horse abscesses more than very, very rarely, you have a problem with foot balance, or you have a problem with nutrition, or you have a problem with both. But horses should not routinely abscess. That should be a rare event. So I'm not going to talk about those because you know what to do about that, and that's typically straightforward to figure out. But it's the chronic one. That's the one that becomes very, very complicated. So by chronic, I mean the horse is lame. You go out one day, your horse is now lame and is lame going forward. That doesn't resolve. They're just lame. Or the intermittent lameness category. So the horse is lame, then he seems better, then lame again, and this fluctuates. And in some cases, it can even change legs and feet. So of this category, these chronic issues, it can be that it's always the same foot or the same leg. So he's consistently off on the right hind. It can move around. So it could be, it swaps front legs or it swaps back legs, or in extreme cases, it can go across all four legs. Or it can be that your horse is actually lame on more than one leg at the same time. These are the hardest things to see because the horse may not actually limp necessarily in an obvious way. So in these chronic cases, so as opposed to these short-term things where the causal event is recent and you're pretty sure you know what happened. In the chronic cases, the thing to bear in mind is the development of that condition is months or even years in the making. It did not start 48 hours ago, typically. So you have to bear that in mind, because when you're hunting for the cause, that's relevant. So when did it start? Well, very early signs that something is going wrong in terms of your horse's comfort level are often fairly subtle. So resting one leg more than the others, that suggests that that leg or foot is uncomfortable. It also could mean weakness, but in this case, we're talking about discomfort. And you're only going to be aware of this, of course, if you're sort of watching your horses and paying attention. Just what do they do when they're standing around and they're not being asked to work? Shifting of weight. So horses do naturally shift their weight from foot to foot, but it should not be every 30 seconds. They should be able to comfortably rest each leg and stand in a relaxed way. It can be a change in hoof wear, and this is where your farrier can be very helpful if he or she notices that, he's really, really wearing down his left hind, which means he's using that left hind in a way that's different. And my interpretation of that would be he's protecting or compensating for a problem in the right hind, or possibly the diagonal front foot. So a change in hoof wear can tell you your horse is struggling, starting to struggle. You can have feet that change in size, and typically what you see is one foot. You look and you realize, boy, that front foot seems bigger than the other front foot. That's not good. In general, just moving around less, becoming somewhat more, not refusing, but when you go to pick up a foot, or when your farrier comes to work on your horse, you might notice the horses takes more time to reorganize themselves before they allow that foot to be picked up, and it may be a particular foot, or it might be more than one foot, but there's just a little bit of postural change in order to allow that. And then under saddle, you might notice that there's a certain reluctance to, go from walk to trot, or go from trot to canter, or maybe there's a canter lead she doesn't really want to do, but if you ask, she will do it. So these are very early signs. They're often not noticed. If your horse is in their teens, for example, you might think, all right, well, she's just getting a little older. But they can be early signs that something's brewing. What about later signs? Now, if a horse really, really struggles, especially if this has not happened before, this has not been the history, or absolutely will not pick up their feet for you or for the farrier, something hurts, or there is profound weakness. But in terms of what we're talking about today, something hurts. I had a client once, a couple years ago, who called and said, do you work on relationship issues between owners and horses? And I said, well, I don't know. What do you mean? Aren't they all relationship issues, right? So she said, well, my mare hates me. She hates me. And I said, well, did you do something horrible to her? She said, no. She's new to me, but she hates me. She hates me. I said, well, how do you know that? She said, if I try and pick up her feet, she yanks her feet away from me and rocks backward. I said, that's not hatred, that's pain. She said, no, she hates me. I said, no. I want you to get your vet. And, she sent me video. It was clear to me the horse was lame on 3 or 4 legs. I said, she's in pain. She's communicating the only way she can. So get your vet. So she gets the vet. He x-rays her, and this mare had horrible, horrible arthritis in 3 or 4 legs. So she didn't hate her at all. She hurt. She couldn't pick up her feet. It was too painful. So that behavior is pain. That is pain, or it's very frequently pain. So pay attention to that. There are very few horses that are just kind of so stubborn-minded. They're just going to do it to mess with you. They're honest. Refusing to pick up certain gaits or leads. And so now we're at the point where the horse is like, I can't do this. They don't want to go forward at all. When they see the saddle, they may start to get really tense, or bite, or maybe even kick out. Step away from the mounting block. I don't really want you on me. You might notice steps shorter than usual, or feeling under you just very stiff and jagged, tripping, stumbling. Increased breathing rate when they're not really exerting themselves also can be a sign of pain. So these are signs of pain. At this point, the horse may or may not be overtly lame. If they're having trouble on more than one leg or foot, they may not be obviously lame. They may not be limping. Two-legged lameness, when it's either both front or both back, can be kind of hard to spot. But these are signs that something is going wrong, and it's become more serious. So the issue is, in trying to pull this apart, so how do we fix this for this horse? The first thing is you got to figure out, well, where is it coming from? Yeah. And the complicated part about horses is there are lots of places it could be coming from. So to amuse myself, I marked up this picture with all the places in the course of working with people's horses who were lame, that it turned out that was where the problem was, or that was where part of the problem is. So you see, basically, you might as well circle the whole horse.
Yeah, because I think you even missed the metabolic issues that don't show up on it.
Well, I'll mention those later, but the thing is that, you know, the horse is a very complex entity from it's just the design is very complicated. And so you can have horses, and we're mostly going to talk about things that start down here. So obviously you want to start in the feet, and I will show you a couple examples where people didn't start in the feet. But, you know, can be any of these joints can be painful, inflamed, arthritic. You can have misalignments in the body that, because of how the horse has to compensate for that, my favorite word, one of my favorite words, one of Wendy's favorite words, compensation, because of how the horse has to compensate for that, it throws their gaits off. So you can have a horse who's got a stuck rib. You can have a horse who's not common, but whose sternum is in the wrong place. Very common, entire pelvis is in the wrong place. They have back pain, probably saddle doesn't fit, and they have a weird, stiff, jaggedy trot because they can't actually use their abdominals, they can't use their back, and they can't engage their hindquarters because all of that hurts. You can have problems with flexibility of the neck that can throw them off. Pull is stuck. Teeth are screwed up. I mean, all of these places can be potential reasons why your horse cannot move in a balanced, even, smooth manner. So, and not to make you just now rip your hair out and go buy a motorcycle instead of a horse, but it's just important to appreciate the potential complexity rather than get discouraged. Okay. So what do you do? So just to remind you, you probably know these things. What does your vet have to offer you with regard to sorting through lameness? So they can do gait assessments. Usually this can be done under different conditions. So different footings at all the gaits, with and without riding, depending on how complicated your horse is. Flexion tests, which you may have seen, which is a hyperflexion of a joint, and then for about 60 seconds, and the horse is asked to trot off. The idea being, if there's inflammation in that joint, when you hyperflex it, the horse will trot off lame, and they will actually stay lame for a bit. They won't take 2 steps, they'll be lame for 20 steps. Blocking, which is a technique of using injections to block specific nerve transmissions at certain levels of the legs, and that helps isolate the site of pain. So is it in the foot or is it in the knee? So blocking can be used to figure that out. Radiographs can be very important to look for really 2 problems: very imbalanced feet, which I will show you some pictures of, and arthritis in joints. So flexion, when a horse has a positive flexion test, that suggests there is an underlying arthritic problem, but without a radiograph, you're unlikely to know how severe it is. And that drives kind of what your choices are to fix it potentially. Tendon and ligament injuries can be really, really hard to diagnose, and you need ultrasound for that. So your vet can offer that. Your farrier is a resource here, noticing wear patterns, location of foot pain, any oddities of how the horse feels when he or she is under that horse. Do they used to be a relaxed horse and now they're very tight and tense because it's hurting them to hold the leg up? And then, of course, from you know your horse's history. You can think backward and think, okay, well, when did I first notice that she always stands with her left hind a little bit in front? When did I first notice that? I think that goes back at least a year, maybe more. So those kinds of observations, all that information together.
Can I put in a plug here for journaling?
Yes, you can. You can. Because nobody remembers anything, right?
Right. So, one of the things we do in the Effortless Horse course, and Lydia Gray is my vet consultant on a lot of stuff, and she's a massive journaler, and she constantly tells people that journaling is so important because we don't notice until it's really bad. But if we just made, and I've had people just do really simple charts with just 1 to 5 numbers on 5 parameters, just check marks, because picking up a foot, you'll feel it one day, that's it's a 0, whereas it was a 5 yesterday. Right. And you'll pick it up so much sooner and get yourself so much further down the road before you wind up
here, right?
Here, yeah, right. Prevention, like rehab, yeah.
Our leverage, most of our leverage in maintaining health, maximum leverage, is in prevention. We have the most torque with the least effort. Yep. The further you get into a disease process, and not that you can't deal with it, you can. And I'm going to show you some very extreme examples that we actually did get these horses comfortable. But the more you're going to have to do, the harder it's going to be. So journaling is fabulous. I am a terrible journaler because I'm very impatient, and I'm always juggling 18 things in my head. But what I do have in my barn is a barn calendar. It sits on the counter, and it's a daily calendar. And so when I go in to feed horses, anything that I see that I think is odd, I will make a quick note in my horrible handwriting that no one else can read, but I can read. So I had a horse, just had horses trimmed, and my young gelding comes in, and he's very short stepping. He comes into the barn for his breakfast. He's short. So I write down, smoke, short stepping. Okay. All right. It's not like him. It's different. All right. And then affect is very flat. Well, he's bright and perky, not normal. So is this gelding in pain? Yes, he is. So just making notes like that, or just that, things that you notice, but it has to be a system that for you is almost effortless, or you won't do it. That's the thing. So you just have to figure out for you. And it might be you just stick it in your calendar on your phone. You make a quick note. Oh, that's weird. Or you send yourself an email, or whatever it is that works for you. But it's very important, because as Wendy says, the earlier you catch these things, it's much easier to fix. So yeah, definitely. So recognizing lameness. Okay. One piece of this is, in some cases, it can be very hard to tell, is this horse lame or is he not lame, or am I just seeing things? And this has to do with the concept of compensation, which again, I do think of as one of my favorite topics. And I know it's one of Wendy's favorite topics because of her very deep training in the Feldenkrais methods, which is all about what we do compensatorily with our bodies. And in humans, it's complicated enough, right? You're a 2-legged creature. You can do all kinds of things with your body to offset the fact, let's say, that one leg's a little bit weaker than the other. So it will affect how you stand. It will affect the position of your shoulders. It will affect the curve of your spine. It will do all of those things. So if you look in the mirror and you notice that one shoulder, let's say, it's a little bit higher than the other, I will guarantee you that the hip under that shoulder, under your high shoulder, that hip is a little bit lower than the other hip, because that twist that started at the top of your body, that has to be compensated for as you go down. So in horses, that's 2 legs. In horses, we have 4 legs, and the amount and the method and the techniques for compensation are so many that you almost can't count them. So this is why it can be very difficult to recognize lameness in horses, because a horse will compensate in myriad ways for some discomfort, and it will be almost impossible to notice that this horse is compensated, because they have the option of 4 legs. So if I offload, let's say my right front foot, it's kind of uncomfortable. I've got the beginnings of ring bone in there and nobody knows. So what do? I'm going to put a little bit more weight on my left front, but I'm going to really offload diagonally to the diagonal hind. Now, you may not notice this because this horse is not limping. It's not. You may or may not notice it under saddle. Really athletic horses are masters of compensation, and they can be really about to fall apart, and you don't know it until they go over the precipice, and then it's shocking. So that's the thing, that horses' ability to compensate is so masterful that, and also when you're a prey animal, you're not going to advertise, hey, I'm the weak one, come pick me out of the herd. You know, even though we aren't keeping our horses in environments where there are saber-toothed tigers going to take out the weak ones, there's a primitive part of the brain that kind of thinks that could happen. So that is, that's why this can be so hard. So so this does play when I'm just running this on, let's see if it will play. I don't know.
Yeah.
You seeing that? Okay.
It is playing. Yes.
Okay.
It is playing.
Okay.
So it's playing enough that you can pick it up.
Okay, great. So there you go. So watch this young gelding. So is he lame?
Yes.
Big lame, right? Do we agree? Everybody kind of see that? He's looking pretty weird in the front. All right. So here's him again just a few minutes later. He's a very nice halflinger. Okay. He's like, what in the heck happened to my body? Okay. All right. So which foot is he lame on?
We're going to get people to respond in the chat.
Yeah. Which foot's he lame on?
Okay.
Yeah,
somebody post in the chat, which foot is he lame on? Okay, nobody's posted. You're going to have to tell them. Nobody's willing to stick their neck out. It's a 50-50 chance here.
Okay.
It's a 50-50 chance. Okay.
Right. I mean, let's get, okay. All right.
We got 2 voting for left front.
Okay.
4 voting for left front.
Okay, good job. Okay. And the way you may have known, and this is one way to identify forelimb lameness. If you notice, his head comes very slightly up when he puts his weight on the left front. So what he's doing, he's using his big head to leverage some weight off the sore foot, and then he drops it down to go on the right. Now, is he only lame on the left? Watch it again.
Well, the fact that he's carrying his head in a very curved to the left pattern is indicating that he's shifting his 40-pound head over to also help with something.
Right. So he's actually lame on both front.
But we're
so that's not a normal step for him. If you notice, the step on the right is very short, even though it's his better foot, but it's very short. So he's not really moving it very far forward. So he's trying to protect the left because the left hurts more, but actually both feet hurt. So that's why he looks so stiff and jagged. Often when a horse is really just lame on one foot, you'll see they'll protect that foot, but the other foot comes way through, and he's not doing that. So he's very stiff in front. He's very tight in front. His left is clearly off, but the right is also off. And he's actually a fairly complicated guy because this is the culmination of about a year of offloading onto his left because he had a tendon injury in the right. So the left has been taking his weight for now, what is this, got to be 7-8 months. So taking his weight. And then he started to get very, very uncomfortable on the good foot. And then he has a little bit of laminitis underneath all of that. So he actually has several things going on. So he's uncomfortable on both fronts. So if you look at him, I'll play it one more time, but just look at him and appreciate he's not just uncomfortable on the left. He's not so happy on the right either. So this is the kind of thing as an owner you can start to train your eye a little bit to see is this is not normal locomotion, even in a horse who's just off on one foot. He's not. He's very uncomfortable.
Yeah, because he's basically crab walking.
Right, exactly. So that means there's pain in more than one place, right? So what did I do? Wrong way. Okay. All right. So in chronic lameness, this may seem like the most obvious statement on earth. We start with the foot. Now, why am I saying that? Because I have been in two kinds of situations where no one ever started with the foot. One set of situations is it's happened 3 or 4 times. Very owners with lots and lots of resources. So this is not a concern about spending money. So they have tons of resources. Expensive horse in all cases, expensive horse. had been lame for a long time on one front. So by long time, I mean 4 to 6 months, had been taken to the medical center, the local medical center, wherever that was, and had everything imaged that could be imaged. Right. So everything has been looked at. Okay. All right, good. So that's pretty thorough diagnostics. Have still come home with a lame horse. And then at this point, I would be called in and said, look, we have this lame horse. Nobody knows what's wrong. All his imaging is clear. We don't know what to do now. What do you do? All right. And so in all of these cases, the first question I asked is, can you send me the radiographs of the lame foot? And there was a long silence, because in all of these cases, early on, someone became convinced it was a problem in the back, and they never radiographed the foot. So that, you would think that couldn't happen. It happens. So just start at the foot. So even if someone with great authority says, no, I'm positive it's in the SI and let's just inject that. No, start with the foot. Because if the problem is in the foot and you never fix the foot, you will never fix the problem. You will never fix the problem, not ever. And as the corollary to that is that your horse will continue to be in pain and will continue to suffer, and you're prolonging that suffering. So start with the foot. The other scenario in which I have been many, many times is when the owner did not want to pursue diagnostics because there had been a falling out with the only available vet, or something had happened and the owner did not desire to go back to that vet. And in one case, a lady actually hauled her horse to me from many hours away so I could look at him. And I knew what was wrong with him as soon as I saw him. And I sent her back to her vet because we had to have radiographs. Have to. Cannot fix the horse unless you know what's wrong. Again, that seems self-evident, but it gets lost. It gets lost, right? So you have to know what's wrong. And I'll tell you what happened.
And Martha, this is where the vet crisis that we're heading into is only going to compound this. And if you alienate the only vet you have near you, you can wind up in a serious hurt. So it's just really important to nurture your vets, because they are under so much stress and pressure right now, and develop a good relationship with them so that when you need them, they're there.
You have to, that's the thing. And relationship is the key word. So you have to have a relationship with one or more vets, because even if you only use your vet in emergencies, you've got to have someone who will come when you call. You have to. And so, much of what I do is I'm not going to say it's counter to veterinary medicine. It's another dimension in which vets are not trained. And there is a fair amount of hostility to that in that community. But I still maintain relationships with 2 or 3 vets here. I don't use them very often, but if I have a problem, I need one. And sometimes I need diagnostics. I need pictures of the feet, or I need, you need something. So you have to maintain that relationship. And really, sometimes the best thing is just whatever happened to go wrong. It's tough being a vet, it's tough being a horse, and it's tough being an owner. So agree to kind of forgive and move on, or find a place you can haul your horse where that has different diagnostics. Maybe you can do that, but you got to start with the foot. So in this one case, this lady, she brings me this horse. The horse has been lame for 3 years, and he's unvetted all this time. So of course nothing worked because she didn't know what was wrong, and she had to circle back to the vet. And just look, patch it up. Just ask him. We're all humans. If you call and say, "Look, I really need your help with my horse," you think he's going to say no? He's not going to say no. So he came, and we did figure out what was wrong. We did get that horse not lame, and I'll show you that. I'll show you what happened to him. All right. So but start with the foot, right? Start with the foot. Don't let someone randomly inject, and don't randomly start with body work and things like that, because you need to know what the cause is. Otherwise, you could be wasting a lot of time and effort and money on things that aren't going to restore your horse to soundness. So feet. So I'm going to talk a lot about feet. Most owners are not well versed in what their horse's feet should look like, and this is a huge part of lameness, foot imbalance. So your horse's feet should be balanced front to back and side to side. So this horse, this is from a client here, this horse was lame, and his foot is in what is called a long toe, crushed heel configuration. So his toe is way too long. He's rocked back on his heel. So these little green lines should be parallel. They are not, because he doesn't have enough heel. When that happens, you force the pastern back into an unnatural angle, and it creates tremendous stress on everything through here. So that's one set of balance. The other set of balance is medial lateral. I'll show you a picture in a second. That's side to side. So when you're looking at your horse's foot, you may have to just get down on the ground to do this correctly. But you're looking straight at your horse's foot. That coronary band or the hairline there should be parallel to the ground, meaning your horse's foot is not higher on one side than the other. A dead giveaway that your horse's foot is not balanced side to side is if your horse always stands with their feet turned out. Very few horses are conformed that way. If they stand with their feet turned out, it's probably because they have a high side and a low side on their foot, and that will break them down over time.
Yeah, unless we're talking about a young horse or a horse with no pecs, because that'll drop them in. So I think we have to just caveat that with there are conditions where horses stand that way. And that's, when I was in Kentucky, they tried to get all the racehorses to stand perfectly square, and so they changed the shape of their feet. But then when they grew, it was a problem because now they wound up pigeon-toed. So we do have to take into consideration the age and development of the horse.
Right. So the most common imbalance that in the horses I see are this long toe crushed heel configuration.
Yep.
And that it's very, very common. So why is this bad? Well, because it forces the pastern into an unnatural angle. It actually is going to create a longer breakover, and that puts tremendous pressure on the heels. It will crush the digital cushion, and I'll show you a picture of why that's bad. So we'll crush that digital cushion over time. So that's the structure that actually suspends and protects the back of the coffin bone. It's a tough fibrous structure with fat in it. And it's literally a cushion. That's what its job is to do. And that torque on the foot will strain ultimately all the structures in the foot and up into the lower leg. And so if that goes on over time, what these horses, often they have heel pain. They often are diagnosed with navicular syndrome. They can be set up for a ligament and tendon injury. And this will definitely over time set them up for ring bone because you're pulling on those bones in the lower leg. So that configuration is, even if they aren't currently lame, you're setting them up to be lame. So why is this so bad? So sort of two ways to look at this. So here's a cross section of a horse's foot. And here, there's the coffin bone here. And so this is a correctly oriented hoof. Notice that this horse has got heel. There's heel. The toe is the correct length. It's because this little bone there, that's the navicular bone.
Is your pointer working?
It is. Is it not showing on your end?
No.
Try here. Right.
There it is. Now I see it. Okay, great.
Got it. Okay. All right, so you can see this horse, this is a balanced foot here. He's got some heel. All right, so all that's good. So here's the coffin bone here, right, that you're seeing from the side, the major weight-bearing structure in the foot. This little tiny bone here is the navicular bone. So horses who are diagnosed with navicular, usually it can be two forms. Classic navicular, there are arthritic changes in the navicular bone itself. It's sclerosed. It's the space between it and the other bones is diminished. But there's also something called navicular syndrome, which means that the horse just has pain in the heel down in here. And the inference is that this area is irritated. That's why the horse has heel pain. This is a tendon here, the deep digital flexor tendon. And notice it wraps around the navicular bone. All right, so it's up against that bone. If this toe is too long, what happens is that tendon is chronically stretched and pulled, and literally it's going to be grinding this navicular bone. So it's no wonder if that goes on for long enough, you're going to have heel pain, and eventually you will have radiographically changes in this little tiny bone. It's a little tiny thing that are making your horse basically disabled. So that's one reason that configuration is so destructive. The other reason is this here, this is the digital cushion. And its job is when this foot comes down, ideally it's heel first, the foot comes down and these bones all rock backward to weight bear the digital cushion, supports all that, and then helps the foot spring up. So it protects all those structures. If the toes are super, super long, then that cushion is crushed. And if you keep crushing it, it gets smaller and smaller and smaller, and it will start to lose its cartilage structure and become basically just a fat pad, which has no ability to really cushion. So it will destroy that over time. Here's a back view of the foot, a diagram. This is from the good folks at Scoot Boots. And here's the digital cushion here. It's this great big, it should be a big fleshy thing that is protecting that coffin bone as your horse puts his heel down and rolls forward. This is what's slinging up those bones and protecting it from the percussion of that. So at the walk, you can imagine that. Imagine a horse who is cantering and jumping. The importance of this structure, you can't overstress. So that's why this is so destructive. So that's
and Martha, I years ago I took Bob Belker's workshop, and I came away with a great way to kind of highlight that for people. If you've ever had plantar fasciitis, it's basically heel pain. It's kind of what the horses are going through. So if you've ever had plantar fasciitis, just think heel pain navicular syndrome.
Right. And it's excruciating. And the other problem is if you're a horse, it's not natural. You can't go lie on the couch.
No,
right? You stand all the time. Again, part of the prey animal wiring is you stand all the time. So that makes it worse. They're not going to want to lie down. Let's briefly just talk a little bit about heels. So, mostly here, I just want you to go look at your horse's feet when we're done, really, and make sure they're okay. So here is a balanced foot here. So this gelding here has got, you can see the angle of the front of his foot. He has naturally an upright foot, but you can have a balanced foot with all kinds of shapes of feet. But he's got heel here. So he's got a nice heel there, which means there's plenty of space for his digital cushion to be present and to do its job. This horse here, I already showed you that, where I had the green arrows. So he's long toes, crushed heels. So his toes way too long. He does not have enough heel. The heel angle here is not correct. This horse up here has no heel. He has no heel. He's literally walking on his heel bulbs.
So you're wondering with the blue arrow, it almost looks like that horse is high-low because the other foot looks like it's got more heel and it's more upright.
Yeah, it might be. We actually did take this toe way back, and she had to change farriers, but we did get him fixed, and he was then fine because he had been lame on this foot for a while.
So somebody's asking if the digital cushion ever heals and recovers.
Yes, it can, but you've got to get the foot in the correct configuration. So you have to get the pressure off the heels, and that can take time. You also, ideally, you want either a barefoot trimmer who's very experienced, like has got a lot of knowledge in their hands, because you have to move this foot back into a healthy shape, and you cannot do it in one trim, depending on how extreme it is, or a farrier who's very experienced with rehabilitative farrier work. But yes, you can. I mean, the fundamental premise of the framework that I use with whatever it is that's wrong is the body always can heal itself. Always. We just have to find a way to let it do that. But yes. And then this one in the top, and I'll explain what you're seeing actually here a little bit. So this horse has no heel. He's actually rocked back. He's walking. You can see his heel bulb looks like it's touching the ground. It is touching the ground. And this is horrific. It causes not only foot pain, it causes horrific pain in the low back and the sacroiliac. So I'll explain that in a little bit, why that is that way. But that you absolutely don't want a foot that looks like that. You can fix it, but it's a long grief. And I actually have had one or two horses, that almost makes me ill. All 4 feet look like that. All 4 horses in agonizing pain, has been unrideable for long periods. He can barely move. And I will say in those 2 cases, no one had looked at the feet. they were injecting the back, right? Start with the feet. So the other sort of issue of imbalance with which to be aware is the medial lateral, this side to side. So here's just a picture to give you a sense of this. So this horse, very, very crooked here. So you can see he clearly, his entire foot is twisted. It's twisting up here in the fetlock. It's twisting up here. It's probably twisting all the way up. And then this was after some rehabilitative farrier work. So his foot.
So we just want to give Yogi Sharp credit. That's one of his photos, right?
Oh yeah, it is Yogi's photo.
Yeah,
No,
we just want to give him credit for that photo.
Sorry,
he's a
Yogi.
documentalist.
I thought I had it. Yeah. So what was I saying? So this orientation will cause damage and inflammation inside the foot, and it's also going to exert this torque. So you can see if this is twisting here, it's going to twist all the way up. So you're going to stress everything. That will, again, it'll cause foot pain. It will cause arthritis. It will cause issues in the pelvis, and often will cause sciatic pain. So, back to start with the feet. Start with the feet, right? So you just want to be sure the feet are balanced. So big picture message around feet is unbalanced feet are the most common cause of lameness. And you can have fairly complex imbalances. So this is another level of imbalance. So these are just two horses that I saw relatively recently. One, a quarter horse in his early teens who'd been lame for more than a year on his right hind. And he also had a very significant hip drop on that side at the trot. He was very angry. He was angry. He kicked out, and he had a lot of pain in his hips. And the owners had tried everything with him to get him sound, and nothing had worked. And they were about to run him through a very expensive PRP treatment, which was several $1,000s. When we connected, and I said, no, stop. Has anyone looked at his feet? No one had looked at that foot. So did radiographs of his hind feet, actually of all 4 feet. But the hind feet, the problem was actually the coffin bones were pointed. It is not a founder thing, but the angle of his coffin bones was way too sharp. He was pointed down way too far. So it was as though he's walking on his toes, kind of, but not a founder toe. This is just a misalignment toe. And that was why he was so uncomfortable. So in the answer for him was to fix those angles. And in fixing those angles, the pain did go away. He had been injected many times, and it would last, not very long, because again, the problem was in the foot. The hip drop stopped, the kicking out stopped, and he stopped being angry because he was in pain and he was upset that no one noticed. And then another one I saw recently, a 5-year-old quarter horse, left hind lame for 3 years, very severe sacroiliac pain, like just miserable. He also angry. He's been in pain. He'd been in pain for 3 years. He's only 5. He's been in pain for 4 years, more than half his life, angry, really severe pain. He had no heels when I saw him. And so we need diagnostics, we need radiographs. And it turned out in his case, the coffin bones were tilted abnormally far up, what's known as a negative plantar angle. Those kinds of complex imbalances where the entire coffin bone is in the wrong place cause enormous amounts of body pain. And one of the hallmarks of those is these horses don't respond in a lasting manner to any kind of body work or to injections. So they'll be better for a day or two, and they go right back to where they were before because they're still standing on the same feet. So what am I talking about with these coffin bone angles? Confusingly, front feet, that placement of the coffin bone laterally is referred to as palmar, and back feet is referred to as plantar. But all you really care about is the fact that the toe, your horse's toe, the most efficient weight-bearing posture for that toe bone is it should be tilted down a little bit. Now, how far it should be tilted down, that depends who you read. To some extent, it depends on the horse's conformation. Most people say 2 to 7, 2 to 8 degrees. It kind of depends, but basically it should be a slight downward pointing here. Some breeds, like Haflingers like a flatter foot. Quarter horses may like a steeper angle, but it's basically what works for this horse, and this horse is comfy, but somewhere in that range. So problems start if this is too steep. So in the first one I told you about, the quarter horse who had pain in his right hind, was kicking out. His angle was something like 14 degrees. So his entire, if you can imagine it, this bone is rotated now a little bit further down. So he was basically walking kind of on the end of his foot. So that's why he hurt so much. The other one, the young one who'd been in pain for 3 years, he had what's called a negative angle. So not only was his coffin bone not pointing down, and it wasn't even flat, it was pointing up. And when that happens, that is excruciating. That is excruciating. Every horse I've seen who has that, or who turned out to have that, has been in severe sacroiliac or low back pain if it's in the back. Because that you can imagine, if you stand up, someday I'm going to do a clinic, and we'll have all these little wedges we can put in our shoes so we can walk around the way our horses walk around when they're unbalanced. But if you can imagine, if you stand up and you rock back on your heels, and now that's the only way you can stand. It's the only way you can stand. And you can feel very quickly, what does that do to your ankles, your knees, your hips, your low back? And now your shoulders are starting to compensate. Literally within 10 minutes, you can feel that. So that's what happened to these horses. So that's why, again, we start with the feet. So the consequences of that, their whole butt hurts. If you stick your thumbs in there, they're usually very, very painful. This is stressful for the suspensories. You're stressing everything that goes all the way up, hock, stifle, sacroiliac. SI pain that's intractable is very, very common with horses with this kind of misalignment. And if you're asking them to move, they're going to struggle. They're going to struggle. They have trouble with picking up the canter. They may have trouble more with one lead than another. They often are kind of stumbling and tripping behind or dragging their hind toes. They may be overtly lame. If it's both feet, though, they may not be overtly lame. They just may be miserable behind. And one of the hallmarks of this is that you see how this hoof capsule is kind of bulged out? That's odd. So the hoof should come straight. It should be pretty straight. So this horse, that was his radiograph. So this horse, he has a negative palmar angle, plantar angle. So his coffin bone's tilted too far up. And you can see the strain on the hoof wall is making it bulge. He also has got probably no digital cushion in there. I mean, it's crushed. There's nothing left, a little bit of fat maybe. So you have to have, in that circumstance, you need radiographs. You can't tell necessarily from the outside where the bone is. The horse who was tilted too far down, you couldn't tell that from the outside of his foot. So you have to have at least a lateral view, that side-to-side view, to know where those are, because that can be fixed. That's corrective farrier work. You can fix that. Until you fix that, the pain is not going to go away. That has to be fixed. So other causes of chronic lameness. So lots and lots and lots about feet. So somewhat less about feet. Thin soles, is a common issue that horses have that can lead to the need to, they can only work on certain kinds of footing, or they have to be shod. That's usually a nutritional problem. Usually that can be fixed. Shoes that are too small. I see that a lot when I see horses in person. They're in a shoe that's a size too small. And this will pinch and constrict the entire foot. And again, you have to think about what you're asking them to do. So, they need to carry themselves around. They're 1,000+ pounds. Carry tack, carry you, and then there's whatever the activity is. And this is all on a foot that's being pinched by a shoe that's too small. And there's no flex in a metal shoe. So if it's too small, he just has to be pinched until, it's time to be reshod. So shoes that are too small is a common issue. Tendon and ligament injury. So if you go through all this sort of foot stuff and you find, well, there's nothing wrong. His feet are pretty balanced. There's no signs of anything arthritically wrong in the foot. Tendon and ligament injuries. These can be harder to track down, and you have to have ultrasound. And typically, You probably want someone who does this a lot and is really good with ultrasound. In little tiny tendons, it can be easy to miss a tear. I have a client with a mare, very high performing mare, Grand Prix level, who's sidelined by lameness behind and went through all the steps I've just described to you. She had absolutely nothing wrong. They had looked at her ligaments, her tendon and ligaments, couldn't find anything, finally took her to Root and Riddle, and they did about 18 more ultrasounds, and they found she had a tiny, tiny tear in one tendon, and that's why she was just in agonizing pain. So they can be trickier to pursue, but that's definitely.
Well, and it's kind of like people too. There's different levels of pain threshold, right? So,
right.
You know, what's one person's like, oh yeah, I'm fine. It's another person's, I'm dying.
I'm dying, right?
I had one of those. I had, you know, the quarter horse with the 4 white socks and the chestnut is everything was like, OMG. Whereas the other one's like, what? Did I do something?
Right.
You know,
I only have 3 legs. I didn't notice, right?
Yeah.
And
yeah.
I had one that was, you know, the tiniest thing. I need you to fly the team in from Switzerland immediately. I need emergency medical care. I need, you know, a full surgical suite. I'm like, I think you bruised your foot. No. It's a calamity, right? So, right. So, you know, tendon ligaments. So again, if you've verified there's nothing structurally wrong really in your horse's feet, tendon ligaments is the next thing to rule that out. And it is a less common injury, but it's also a frequently overlooked injury, at least in my experience.
I think it's actually more common than we realize, because I think the damage is happening over a long period of time before it actually reaches critical.
Right.
But shoeing has a lot to do with putting stress on the tendons, so that you get the small tears over a long period of time, right? I mean, that's the kind of yeah.
Right. Well, right. Again, the whole thing about foot balance is, if the foot is chronically imbalanced and you start that way at 4 and now your horse is 15, there are going to be consequences to that. And and it sets them up to be more vulnerable to injury. So you also can have horses who are lame because mostly the problem is in the soft tissue. Like their muscles are really, really sore. I had someone bring me recently a young OTTB. It was huge, 17.2. So he's this enormous creature. He gets off the trailer. He's taking steps behind that are about, 5 inches long. So he's short stepping on both hind. His feet look fine from the outside, but just the way he moved, it didn't suggest that there was something wrong within his foot. So I just kind of poked and prodded a little bit in his gluteals, and he was so sore. He's so sore everywhere. And he had been in training, and he had been really pushed just really too far for his fitness level. He really was not competent to carry a rider at walk, trot, canter. He didn't have the strength or the coordination, and of course he's still growing. So he really had just been overtrained, and there wasn't really anything else wrong. We did do some blood work to rule out a couple things, just because in Virginia you have to worry, is this horse Lyme already? Is that what we have? So we did that, and he didn't have any of that. So his whole back end was extremely painful, but soft tissue. His pelvis looked like it was in the right place. I mean, you can kind of tell. But I did have a practitioner come who does some chiropractic and some acupuncture to go over him, and she verified. She said, no, all the bones are in the right place. This is overtraining. He is just sore. His feet weren't sore. There was nothing wrong in his lower leg. It was all the muscles of his rump. And she stuck needles in him, and within 30 seconds he was like, oh, thank God. So it can be that. So one thing is to, put your hands on your horse. I mean, people pat them, but palpate them a little bit. If you push your thumb into a muscle on the side of a rump and your horse withdraws, that's sore. So they shouldn't be that sore unless you just did, a pretty strenuous ride. And if they are sore, then you want to check the next day and make sure, is that going away, or are you still sore? Because if you're still sore, we need to sort of think through how not to have that happen for you. So it can be that. Arthritis, obviously, if you have arthritis anywhere, that's gonna cause pain and potentially lameness. And you really need radiographs to see how much arthritis do we have here. How bad is this? Although I will say imaging isn't everything, and I'll show you 2 examples of why I believe that's true. There also are systemic things, insulin resistance and or Cushing PPID, especially if this is a seasonal pattern and your horse is just uncomfortable or kind of lame in the spring and then kind of lame in the fall, but really pretty much okay the rest of the time. This could be a metabolic issue because horses whose insulin is running high, number one cause of foot pain in metabolic horses is their insulin's not under control. So insulin will create foot pain. Very high insulin causes laminitis. So it's worth checking that, especially if you've got an easy keeper or you have a breed who has tendencies in that direction. Or in Virginia, on my farm, probably on Wendy's farm too, we've had insane amounts of rain. We have insane amounts of grass. I have more grass than I typically have. So I have lots of local people are like, Martha, my horse's feet are hot. Like, get him off the grass, get him off the grass. So again, this is the kind of thing you just sort of want to know. If your horse also has an elevated ACTH, adrenocorticotropin hormone, so Cushing's PPID, that by itself can create feet that tend to be sore. But if you put that with elevated insulin, that's a pretty good prescription for sore feet. That's generally bilateral. It's not normally that one hurts more than the other, so they're obviously lame. However, if you have another underlying problem in one foot, it can flare both feet, and you can end up with this, which basically they look lame, but actually both feet are sore. Systemic infection, again, it kind of depends where you are and what's in your area. Around here, East Coast, although I think Lyme disease is almost everywhere now. Lyme disease can be a culprit because there's tremendous inflammation that goes with that. One of the hallmarks of horses that are lame from Lyme disease is the lameness moves around. So it's the right front, now it's the left hind, now it's the left front. What is going on here? So that's, again, worth ruling out because you can do something about that. And I'm not going to talk about saddle fitting. I'm not expert, but saddle
not even go near that. Okay, thank you.
Let's just tell you, if your saddle doesn't fit, you're setting your horse up for a disaster. And I wouldn't even attempt. To me, you have a professional saddle fitter with training, and they know what they're doing, and your horse is back.
And I have webinars on that.
Right. So saddle fit, right? We won't go there. It's a scary topic, right? So other reasons your horse could be chronic lame. So this is sort of in the structural misalignment category. So one or more ribs that are out. This is actually pretty common. Horses, they roll, they move around, they're goofing around the pasture, they play, they put a foot wrong and they twist to catch themselves, and they can pull one or more ribs out of position. So this is pretty common. The sternum out of position, I have only ever seen that once, and it was dramatically obvious that that's what it was because the horse had no pectoral muscles on one side of his chest. His entire sternum was twisted to one side. And we called the chiropractor and we had her pop it back in. And then suddenly he had a normal chest. So that's rare. But if you look at your horse's chest and they have chest muscle on one side and they have no muscle on the other side, it's very likely his sternum is not in the right place. A misaligned pelvis, this is very, very common among the horses that I see. So by misaligned pelvis, I mean the pelvis is either tilted too far forward. That can happen as long-term compensation from a saddle that doesn't fit. They're in that hollowed out posture to protect themselves from the saddle coming down too hard on the lower back, or the pelvis is tilted too far back, or it's twisted, meaning it's literally twisted. And those horses, usually you can kind of see that because one hip will be very slightly higher than the other, but it also can be quite subtle. But that actually is a common bony misalignment. Neck being tight and stiff and stuck, that's very common. And the pole being stuck is also very common. So again, if you're working your way through this process to sort out what's wrong, and you get to this point where it isn't these other things, but could it be these, then you want to sort of think through how you work through these possibilities. So you need somebody on the beginning of this process who can check for bony misalignment and correct it. And then you may want to go on to other body work modalities. So I only tell you this because I didn't really think this through when I had one of mine who had a chronic problem behind, and he had lots of soft tissue work, and he loved that, and he was better for 2 days, and then he was right back doing what he was doing. And so finally I thought, Martha, what a moron. Why don't you have somebody check his back? So I had the chiropractor come, and he went over him, and he said, so his pelvis is twisted. It's been twisted for years and stuck in this wrong position. Again, that's not uncommon. And until you untwist it and stick it back where it belongs, all the soft tissue work isn't going to do anything lasting, because none of those practitioners have the training to put a pelvis back. So he did do that. We had to go through several iterations of getting his pelvis to stay in the new position, because, the first time it just snaps back to where it used to be. And finally it did stay. And then the other body work modalities were very supportive, because now we want to teach those muscles to stay in this position with an aligned pelvis and not have him be tight on one side. And also a fair amount of acupuncture was super helpful in helping his body accept this new alignment of his bones. So just based on my experience, because I wasted thousands of dollars in body work, it made him feel good for 2 days, but didn't fix the underlying problem.
Well, so, and I think that's a really good clue is it holding?
Right.
And if what you're doing isn't holding, you've got to start looking deeper.
You've got to look deeper, right? And that's also, if you have not, at that point, if you've not checked for systemic illness, you need to check, because if the horse is really just keeps going back to how he was, then we're missing something.
Right.
So here's just a couple case examples. This is just sort of a caution around imaging. So imaging is magical in a way. 50 years ago, you couldn't look inside the body and see, well, what the heck's in there? But you can now, and it is magical, and it can be an incredible tool, but it's not everything. And there can be a tendency to take the imaging as that's the total reality. And the animals that I work with are usually ones that are, not usually, but 20 to 30% are in the category of nothing can be done. We're at the end of the road for this animal. So I'm just sensitive to this. So these are radiographs of a Frisian in his mid-teens, and he has very severe ring bone. So if you don't really look at radiographs, all this blurry, gunky mess here and here, that's bony stuff that should not be there. And he also, if you'll notice, there's no space here between these bones. He's got no cartilage. There's no cartilage left. So he's basically pretty much bone on bone in both front legs. He's got all this yucky ring bone, high and low, kind of worse high up, but it's everywhere. So he's a mess. He had been through all the usual anti-inflammatories. They can't live on bute. He couldn't tolerate bute. And he was in intractable pain, and euthanasia was recommended because the belief was there was no way to control his pain medicinally. And that was true. There wasn't. However, I did get him sound on a cocktail of anti-inflammatory supplements, since he really couldn't tolerate meds. And he did stay sound for another 4 years, when he did pass away of something else entirely. But he was sound during that period. He could walk and trot in the field. It has to be, in quality of life issues, it has to be a life a horse would want to live. And he had a life he wanted to live. He was good. Right? He was good. So the imaging is crappy. It makes you go, well, I don't know, but imaging is not everything. He was good. He had a good extra 4 years there. This one's way worse. So this is a mule, 15-year-old mule. This mess, this is all arthritic changes, all of this god awful mess here with her. So this is a mess. This is the worst I've ever seen. This poor animal. She has no cartilage either, and she came into a rescue that I work with. And so we don't know her history or prior use, but whatever it was, she was not well taken care of, clearly, because this is very severe. All right. So immediate euthanasia was recommended. She was miserable. horrible pain. It is not believed you can do anything for this. And I'll show you how she looked when we started. This is Mushka. You've seen the radiographs, right? Right. So she can barely move. She was lying down a lot because she hurt so much. So of course she would. All right. So we're just part way into this with her. So she's actually she's a complicated lady because she's super picky. And and the ones who need it the most, you just eat what I want you to eat. There are some things you can syringe, right? But they won't. So there's some things you cannot syringe in. So we're partway into this. She's not on nearly everything that I want her on. However, she's way better.
Yeah. How long did that take?
About 2 weeks.
Well.
Yeah, she's way better. And she would get way better if she would let me do my job, Mushka. So right, imaging is in everything. So her images are horrific. Those are the worst I've ever seen. And yet she's doodling around. I mean, she's clearly not sound, but she can move around. She's laying down way less. Is it a life you want to live? Right now she's saying, yeah, she does not want to go. She wants to stay. So we'll continue with her. So, terrible imaging, but still walking around. So, again, that's just a caution around that, because people sometimes think, well, I got this report back about my animals' radiographs and we're at the end. There's nothing. That's kind of your decision if there's nothing. You do need imaging and diagnostics to understand exactly what's going on. So yeah. There is little to be gained by not wanting to know, because if you don't know, we can't help. I mean, that's the thing. And it's very valuable to guide treatment choices just to see, all right, well, how bad is this really? Do we need to throw the whole arsenal? Like Mushka needs an arsenal if we're going to get her consistently sound. So it's valuable for that reason. But the pictures don't tell you what's going to happen. They don't. So the pictures can't predict responses. So, the Frisian who became sound, that was unpredictable. In fact, the vet saw him multiple more times during his life, the same vet who had said he needed to be euthanized, and she couldn't believe it. She didn't believe it was possible. But he was good. And Mushka, similarly, she's not fabulous right now, but she's a heck of a lot better than she was. So you don't know what's achievable in terms of quality of life. And some of that has to do with the animal's desire to be here.
Yeah, I was just going to say that it's such a decision, isn't it, between the animal and how they feel about it and what they're going to have to go through to be better. I see sometimes where people make a decision for an animal, but it's going to take years. And how do you explain to that horse he's going to be uncomfortable for years, right? And then what's the quality of life and what it's going to cost the owner to sustain that? And I think that that's a piece that is really important to be considered, is the economics of it. Because I think just like with humans, sometimes we get into sustain life at all costs, and the cost in the end is the person who is still around.
Right. No. If you have an animal who has something complicated and it requires a lot of management to keep it under control and create that quality of life where, okay, this animal wants to be alive. There are the economic complexities.
Right.
There's the animal's personality, which is a tremendous predictor of living or not living.
Yeah.
And the animals that I live with, there are animals who want to live and they will fight their way through things that you wouldn't believe. This is not possible, but they're still alive. But the other part of being the owner on that end of that relationship. So there is the financial issues, absolutely, but there's also what it's like to have to bear witness to pain.
Right.
And for many of us, that's very, very hard because it is a form of running hospice, and hospice is rough. I've run many here for older animals who didn't want to die. And it is one of the hardest things I've ever done in my life. I would do it again, You know, in all cases, it was desired by the creature. I don't want to go. I want to be here, and I want you to figure out how to keep me here. Okay, I will do that for you. But it's rough, especially if you have something that causes pain or something that, you know, gets worse and better and worse and better. And you never quite know when you go in the barn what you're going to be faced with that morning. And that's hard. So
yeah, and I don't think that's, you can't, you have to be in the experience to make the right decision. You can't make it from a theoretical perspective. There's too many variables.
No, there's too many variables, and nobody can make it for you.
Right.
It's a very intimate decision. It's between you and your creature, and those are the only voices that matter. So,
people have asked about your anti-inflammatory protocols, but I think that's kind of not in the purview of this conversation.
It needs to be ideally customized to your situation. So there isn't one. I'll tell you a bit toward the end about just the general relevance of diet, because diet is very important. If you're feeding pro-inflammatory crap, it isn't going to help. But there are specific supplements, and in horses who have really severe conditions, I usually cocktail those. They work chemically in different ways. So the idea is you're triangulating on this problem. You know, with arthritis, we want to push blood flow, knock inflammation down, remove scarring, and you might want to fiddle with some circuits in the brain that affect pain perception. So, but that would be a tailored cocktail for that particular animal. And there is some trial and error. So, you know, you have to move through a process to figure out what works for you. Does this work for you? Okay, fabulous. Then we'll do that for you.
Yeah, it's not just a cookie cutter or simple answer.
It's not if it's beyond something very minor. And also you want to make sure you want to sort of use the minimum that you can use to achieve what you want to achieve. And again, that takes some trial and error. And sometimes I use things that are not on the market, but that I can get for a horse that's in an extreme condition. So, okay. So resolving big picture. So you've gone through all this now. Now what? So basically again, these are sort of self-evident points, but they get lost in the shuffle of, he's lame again, and I don't know what to do. And different people have different opinions. The trainer says this, the vet says that, my friend says this. But big picture, until the cause is identified, it's very difficult to resolve lameness. So you really have to circle hard until you have a reasonable idea why. These horses get injected all the time. I've seen horses who've been injected 10 times, especially performance horses. So they're doing barrel racing. Or they're doing something that's very, very demanding, and they get injected constantly because it gets them better for a short period. But if the problem is in their feet, it's never going to fix it. You can't inject imbalanced feet away. You have to fix the feet. And then the third point here to bear in mind is that lameness, it's hard to resolve in horses who've got an underlying systemic problem. So they have an illness. So again, East Coast, chronic Lyme that's undiagnosed is a big culprit, or a metabolic dysregulation. So their insulin is running high, their ACTH is high, both are high. So it's very hard to grapple with an inflammatory condition that's resulting in lameness if you've got an underlying disease state that is constantly flaring inflammation. So you have to grapple with that. So those are just sort of 3 takeaways. So what do you do to resolve this? Your horse is lame. Back to the basic stuff. Start with the feet, start with the feet, start with the feet. So foot balance, radiographs if you think you need those. Talk with your farrier, talk with your vet. Rule in, out tendon and ligament problems. Look for arthritic changes, especially cartilage loss of bone on bone animals. That is extremely painful. There are some things we can do. If your animal has any cartilage left, we should intervene hard to preserve what is left. But your vet can help you with this. So flexion tests, radiographs. Bony misalignments can be a big culprit. And obviously you can have more than one thing wrong. So a horse that's been walking around on crooked feet, probably half their spine is in the wrong place, right? So because they've had to compensate for years for the fact that they're all twisted underneath. So so you have to kind of step through this process and sort this out. And the idea is what you're doing is you're working through this to restore your animal, to a pain-free existence. And then soft tissue pain, again, often overlooked. I'm amazed, really, also at myself, that when we put our hands on our horses and we pet them and then we groom them and then we saddle them and then we unsaddle them and, hose them down or whatever we're doing. But we rarely kind of stick our hands into the muscle tissue and really, really, push or poke or try and feel, is this comfy for you? I just rode you for an hour and a half. How's your back? Your back should not be sore. Your hindquarters shouldn't be sore. So if you have a lot of soft tissue pain, it can be overwork, inappropriate work, especially in a young horse who does not know how to use herself. I mean, she doesn't know how to collect and use her hindquarters. It can be just a horse who's being pushed too far, too fast. Again, the feet, inflammation in the joints, saddle fit where we're not going, but it's a huge culprit. Metabolic status, systemic illness. So you're just sort of checking these boxes. Okay, did I do all these things? Okay, yes, no, I did, I didn't. All right, so 2 frustrating scenarios. You do all the stuff and you know what's wrong. We know the horse has this, but there is no recognized answer for that. So you're in the realm of nobody knows what to do. And when you have something wrong with your horse, you don't want to be in the realm of nobody knows what to do. You want to be in the realm of, oh yeah, I see this 5 times a week and I know exactly what to do. You don't want to be where I have no idea. So what do you do when no one knows what to do? Some of those people end up talking to me. One is because the holistic toolkit's got a lot of tricks in it. It's a giant toolkit. I've got all kinds of things we can try, even if nobody knows what to do. And it generally does no harm. So it isn't that you're experimenting with medications. I mean, we're experimenting with nutraceuticals, and typically they aren't harmful. So the holistic toolkit in that case, which includes definitely a dietary change, just to dial back any full body inflammation that is making this condition worse. And a really good case example is an 18-year-old mare I saw in October. She actually came to a clinic on my farm, and she's absolutely what you don't want. Oh my God. So lovely OTTB mare, a war horse, raced almost 50 times.
Wow.
Strong, powerful work ethic. So frustrated because she had been lame. I think it's her left front, but I can't remember. She'd been lame on the left front for just freaking endlessly. She's so frustrated and irritated by it. Her owner, so she was a free horse. Her owner is a young lady. And the owner is like,
no such thing as free, okay? Okay, let's just start there. There's no such thing as free.
Define free, right? Define free. Yeah, so her owner is a young lady and is just at her wit's end and bumping up against her resource end, and has this animal, and they're clearly attached to one another. And so what happened in this case is this mare, she got the mare and she kept abscessing in the same foot over and over and over in the foot. So they had radiographs, and the radiographs, they looked a little odd, but nothing alarming. So kept going, abscessing. Now she's lame, even when she's not abscessing, she's still lame. So ended up getting an MRI of her foot, which revealed something no one had ever seen. Which again, you really don't want. So several different vets look at it and went, I've never seen one of these.
That's not what you want to hear, right?
Right? And then they sent to a third vet who is highly specialized in imaging. And even she said, I've never seen this. So it turns out it's this poor animal. She has, I'm going to call it a tumor. It's a mass inside her foot. It is destroying her foot. It's destroying all the structures in her foot, and it's destroying the tendons and ligaments around the foot. It's destroying her foot. So, and it is a strange thing where it doesn't really have classic structures. If a particular tumor, it looks most like something called a hemangioma, which horses do get, but they don't get them in their feet. And it's not even entirely clear what that is. All right. So she brings her to the clinic. She says, what can you do? And I'm thinking, I don't know. I don't know. This is a problem. So she also had some other issues which are common with thoroughbreds who raced a lot. So some very, very severe gut issues. So I said, all right, well, we can fix her gut. Let's work on that. She had skin issues, but it often goes with a screwed up gut. So fix the gut, we'll fix the skin, change her diet around, just knock her inflammation down. But we still have a tumor in the foot, Martha. What are we going to do? So we tried two things. neither of which would do harm, that being very important. One was to give her, there is a nutrient that cystic structures do not like. And the tumor had kind of cystic characteristics. I said, I don't know if it's a cystic tumor or not, but let's just give her some of this and see what she does with that. So it won't hurt her if either it'll do something or it won't do something. But the other thing was to try and unwind why do you have this in your foot? You know, so why has the body created this? So there is an underlying logic to what the body does, even though the outcome sometimes makes you just like, why would you do this? And the best analogy I can think of is if you've ever seen a horse who has a shoe boil. Mm-hmm. You know what that is? So that is when they have harmed their elbow, usually in the front, because when they lay down, the shoe on the hind, clonked the elbow. And in some horses, the body over responds to that, and it makes this enormous fleshy mass on the elbow as a protective structure, but now it's very, very vulnerable to being constantly traumatized. So there's this hyper responsiveness. So the only thing I could think of that might have happened to her, and I have no idea, this was pure intuition, was she injured her foot on the track at some point. Her foot was injured. So we don't have any details about her history. And so again, I'm riffing out there intuitively. I'm looking at the mare's looking at me, she's pissed off. I'm only 18. I got a lot of work I got to do. I'm like, all right, let me think of something. So the only thing I could think of was that if something had happened to her foot that traumatized her foot, and it may not even have been something anyone really noticed, mm-hmm. her body, for some reason, over responded to this trauma. And it created a fluid-filled structure that's basically a huge, huge bruise inside her foot. Because the thing is full of blood.
Wow. Okay.
It's full of blood. So it's like a giant bruise, but you're talking a bruise the size of a walnut in her foot. So it's the only thing I could think of. Okay, well, why is that even remotely useful? Because what are you going to do about it? Because no one wants to touch it. They're not going to operate it. They don't want to stick needles in it. You don't want to touch it. Because mucking around with things like that, if you piss them off, often they just go crazy. So the only thing I could think of was actually to use some homeopathy and basically ask her body to let go of the memory of this trauma. And that's the only thing I could think of. Like, all right. So I said, we're going to try this. I don't know if it'll work. It costs $8. So who cares, right? I will give it to you. You start it today. And we're going to see what she does with this. So that remedy, and so don't, I'll tell you what it is, but
no, don't share it because it's so specific.
No, someone will go use it, right? And it won't. Yeah, I won't tell you.
Homeopathy is this is not the purview of this talk.
Its own discipline. Anyway, so she gave her this remedy for about a week, and nothing happened. I said, well, pause, because remedies are powerful and they keep working. And then I want you to restart in a week. So she did that. Around about the third cycle, the tumor started to shrink. So we fast forward now. So that was October. So this is 5 months later. The tumor has moved out of her foot. Wow. It just shrank, contracted. It's sort of parked now, like up above her heel bulb, but it doesn't hurt anything there. It can sit there forever and ever. No one cares. Every time she does a cycle, it gets a little bit smaller. She quit abscessing. She's now sound on the foot. She's sound. She's back in work. So is that a typical case? No, because that was completely an intuitive approach, but I honestly could not think of anything else to do. Like, if this is either going to work for you or it's not going to work, but it worked. So that worked. Mare's sound. So wild case though, most extreme case I've ever had of something that bizarre. The other frustrating scenario is when you go through this entire process and at the end of the process, you got nothing and you still have a lame horse. So everything's fine. No one can find anything wrong. Everything's fine. You'd almost rather something's wrong because at least you have an attribution for why this horse is off. So I've had quite a few of those. They tend to be younger horses, not so much older horses. So in older horses, typically you can find something wrong just because they're older. in younger horses, you may not find something that's overtly wrong at a level we can measure. Let's put it that way. So this was a young warm blood who'd been persistently lame on his right front for, I don't know, 6-7 months by the time I saw him. He'd had gone through the whole thing, right? And there was nothing. There's nothing wrong with his foot. There's nothing wrong with anything that anybody could find. And so in that case, that when I said, well, what do we do? I said, well, let's change his diet, because he was being fed the way horses are generally fed. It's very pro-inflammatory. He might just be super sensitive. Let's just change his diet and see what happens. So we did. And in something like 8 days, he became not lame. So there was something about that. And he stayed sound. So she kept him on that diet and he stayed sound. At one point, I think she crept something back in and he flared up. And I said, what did you change? She said, let me change it back. So you changed it back. So I don't know what was wrong. For some reason, that foot was particularly sensitive to inflammation. And when his food was, basically when he was fed things that helped keep full body inflammation down, then he was sound. And he stayed sound. So again, with client horses, I always start by fixing the diet, because it doesn't matter what's wrong. Most things will get better just from a diet change. Just like if you're eating hot dogs from 7-Eleven and drinking a Budweiser for breakfast, if you change to a much healthier diet, in general, you'll feel better, and other things that are wrong with you are going to start to dial themselves back. So that did fix him. And I've had a whole set of those where no one really knew what was wrong. Yeah. So why does diet matter? I'm not going to go into this a lot of detail, but food matters. Food matters. What can I tell you? Food matters.
Yeah, you have another webinar, I'm sure, that we talked about diet. I'm sure of it.
Yeah. So it matters for all these reasons that, it has to do with inflammation that's driven by food, with gut stress, with making sure the animal they actually are eating the things that they can use to fix and maintain themselves, because that's a huge problem. And part of that is that nutrients have to be bioavailable, and in many circumstances they aren't. The anti-inflammatory diet that I work with, and there's, is just basically to avoid inflammatory foods that are heavily sprayed, because you don't want to eat this. You don't want to eat it. They shouldn't eat it. It doesn't help them. And focus on gut health for efficient nutrient absorption, because the bottom line is, if the gut doesn't work well, almost doesn't matter what you feed. So, and again, I won't go in much detail on that. And then making sure nutrients are actually nutrients that in a chemical form the horse can use. This is a huge problem in commercial feeds. Most of the minerals in particular are not bioavailable. And so you end up with a horse who's being fed what they're supposed to be fed, but they're actually malnourished. And then, with joint issues, there are specific supplements that to be used for joints and for inflammation that target blood flow, inflammation control, scarring removal. There are a couple that will support bone resorption. So when you have abnormal bone formations like ring bone, that will try and stimulate the body to stop doing that and then dial it back. So but basically you're triangulating on the problem, and the diet, the way that the feet are the foundation for the horse's alignment, diet is the foundation for keeping them in vital health. I mean, there just is no, no way around that.
Yep.
So. Oh, so this just one last, just for fun, lameness. Is this mare lame? Lame or not lame?
Lame.
She's lame. Where is she lame?
Okay, guys, come on, put it in the chat. Where do you think that horse is lame? You want to see the video? It's a good test for y'all.
Yeah, it's
a week. You want to play it again?
Yeah, here we go. She's fat. She's way too
Yeah, she's fat. That was my first thing, is all 4 feet, but
yeah, she's way too fat. She's a Chincoteague pony. She should not. Yeah. Yeah.
hey, somebody's got to type in the chat. Where's this horse lame?
No.
Nobody seems willing.
Nobody wants to say. Do you recognize that she is lame? Let's start there.
Ellen says all around. That was my first.
That's a good call, Ellen. She actually is lame on all 4. It's most obvious if you watch her hind legs. Yeah. She's having some she looks better there than when I saw her 24 hours before, because she's had some anti-inflammatories, but she's got mild laminitis in the front, and she broke her pelvis about 7 years ago. And that is, you're very irritated right now. And probably because she has to compensate for the pain in the front. So she's having to use her hindquarters in a way that causes her pain. So she's basically miserable, actually. But so subtle, you look at her, her owner asked me to come because she had the trainer look at her. She'd had the stable owner look at her. She had had somebody else look at her, and they all said, well, she's fine. And I said, she's not fine. She's not fine. She's not fine. She's definitely in significant pain. And she's a tough pony mare. So she's going to hide what she can hide. So,
yeah. So we've got soul pain, sacroiliac, particularly hind and front on the left, and all around.
Yeah.
I don't think anybody went wrong.
Right. No, so you can't go wrong with this one, because she's got something going on all over the place. But it's a good example, too, of how the body, compensation can flare up old stuff that you thought were long gone. So her original injury is 8 or 9 years ago. And she's not uncomfortable like this all the time. But when something went wrong up front, now all of a sudden you see that the back actually is not entirely normal either. So, and that, this took about a week to manifest itself. And she'd gotten to the point where she was standing around completely parked out, because she was trying to take the stress off the front and the pain out of her hips. So,
so Ellen's asking if horses can have one leg shorter than the other.
They can.
But I think what I would probably say is it's probably similar to humans when we attribute it to a limb lameness, and it's actually an axial skeleton issue. You see that the high-low with horses, like their front legs aren't really different, but their heel height is different because of the way the load is on their leg.
Right.
So I think it's a huge abnormality to see a horse with an actual physical limb differential where the bones are actually different lengths.
Yes. It's a loading thing. It's a misalignment thing. It can be a soft tissue problem, again, where if they're very tight on one side and that is pulling something, it can make it look like the leg is shorter. So again, you kind of have to go through the steps to figure out. And then my brain just left me. I had another example. sometimes in very, very young horses who are not fed properly, where you start to get bony distortions around the joint capsules, and they can actually get to where the leg is sort of shorter because the joint is so malformed that they can't put the foot down in the same spot as they can the other foot.
Right. And they can be born with a club foot and that sort of thing. So
right.
Yes, but you have to think a little deeper.
Right.
All right. So we unpin that. There we go. Awesome. Well, that was fabulous. Thank you so much, Martha.
You're welcome so much.
Yeah, and it just feeds in great with a course that I've just launched called The Effortless Horse, where I help people see and feel things in their horses, because so many people, we know we need to see it, but the question is, have we educated our eye and been trained how to do it? And it's skills that we can all learn.
Yeah, absolutely. You have to really, in training the eye, what you said is exactly the thing. And the eye training is less about precision, and it's more about recognizing flow and hitches in the flow, at least in terms of what I do. But you can train your eye so that as you watch a horse move, if something catches you visually, that's what's wrong. That's the thing that's wrong.
If somebody's asking if there's any reason a horse would have a dish foot in front, the answer is yes. depending on where's that coffin bone.
Right. That you definitely want radiographs to look inside there and see what's going on.
Yeah. All right. Well, thank you so much. It's been a pleasure to see you again. And thanks everybody for tuning in. And we'll see you next time.
Okay, super. Thank you so much. Appreciate it. Y'all take care.